A very good morning, everyone. This is Dr. Singaram. Welcome to the topic of week series discussion. This is the first topic I have taken up for discussion today, that is on pediatric COVID-19 updates. So, before I start the discussion, let me give you a brief introduction to what is this topic of week series. This is a set of topics which I am going to discuss over the next few weeks, leading to your preparation to NEET PG exams. But this topic which I am choosing every week is not only important for the PG aspirants but also for FMG aspirants as well as for undergraduate students who are preparing for their university exams. Every topic discussion will be followed by MCQ discussion relevant to the topic, but for this particular topic alone I have not taken up any MCQs, but from the subsequent discussion definitely at the end there will be relevant MCQ discussion. So with that introduction, let us start the discussion of the topic proper. This COVID-19 infection is caused by SARS-CoV-2 virus. What is that? Severe acute respiratory syndrome coronavirus 2. So that means there is something called CoV1, which I will come back to you in some time. As of now, let us concentrate on the agent causing COVID-19, which is SARS-CoV-2. It is a positive single-stranded RNA virus, and the structure of the virus is important for you to know about. Now you can see that there is a RNA genome here, and surrounding the RNA genome is this N protein. What is this N protein? N protein is nothing but the nucleocapsid protein. And you can see that in the structure of the virus membrane, you can see these protein. What is that? S protein. What does that S stands for? S is the spike protein. Okay. Now you can see the shape of these, which are looking like the spikes, or what we call it as the petal shaped projections. Okay, which is something looking like that of the solar corona. So that is why it is also called as a corona virus. Okay. What are the other proteins? E protein, which is the envelope protein. Then membrane protein, which is the M protein. Okay. Why you should know the name of all these proteins? Because all these proteins are what we call it as the antigenic targets. What is the meaning of this antigenic targets? Whenever we are doing the test, okay, for detection of this coronavirus, what is the common test which we are going to do? Yes, they are called as the NAAT test, which is the nucleic acid amplification test. Okay, the typical example is RT-PCR. Now, during this nucleic acid amplification testing, these antigenic targets are what we are actually going to detect and helps in the identification of virus. So that is why you should know the name of these proteins, right? Now, once the virus enters into the body, what is the receptor for the virus inside our body? Or what is the receptor? Yes, the name of the receptor is ACE2 receptor, which is angiotensin converting enzyme 2 receptor. Now, this is a very important receptor for you to remember. It is present in most parts of our body, but they are abundantly present in some areas, which is what you need to remember very correctly. Most important is in the lungs or respiratory tract in general. Second is the gastrointestinal tract. Okay. Third is in the central nervous system. Fourth is in the endothelium, which is the lining of the blood vessels. The most important area, of course, every one of you will be remembering is the lungs, but it's also present in the other areas. Now, especially in children, you need to know about this GIT and CNS expression of these receptors, because it is said that, I'll come back to that point little later also, it is said that there is a alteration in the expression of ACE receptors in children compared to the adult. So some of the children may have more receptors in the GIT and CNS, so that is why they may present with gastrointestinal or central nervous system features rather than as respiratory manifestation. So that is why you need to know about. In fact, gastrointestinal tract expression of this ACE2 receptors is important in the pediatric population, because in certain set of study about this COVID-19 infection in pediatric population, they have found out that some of the children can actually present with gastrointestinal manifestations like vomiting, diarrhea and abdominal pain rather than as coughing and respiratory distress. Are you able to follow this? So that is why you should know the location of this receptor. Now, regarding this endothelium, okay, which is the lining of the blood vessels, you should know them, because I will come back to it for a certain point later in my course of discussion. Okay, right. So let us concentrate on the next part, that is regarding the transmission of virus. I'm sure that all of you must be knowing the transmission of virus is via the respiratory route, which is what? Yes, the aerosol spread. Whenever a person is coughing, sneezing, or even talking, okay, this virus can get transmitted. Okay, right. So that is why we are actually using that protective equipments, mask, as well as maintaining the social distancing. Now coming to the pediatric transmission, okay, remember children are not primary cases, they are not primarily infected, rather children are secondary cases. What is the meaning of this? They are going to acquire the infection from an adult who may be the primary case. So it, pediatric cases are always secondary cases. That means what? You should always look out for some other person or some other adult in the family or the neighborhood who is actually suffering from the disease, and that needs to be traced out, and that is what we call it as a contact tracing. Okay, so remember, in pediatrics, it is only secondary case. That means they have acquired it from another adult who is the primary case, right? So there are also other coronavirus outbreaks which have occurred in the past. One is the SARS-CoV-1, which is coronavirus 1, which occurred in 2002. Next is MERS, which occurred in 2012. These were the previous outbreaks of coronavirus which you need to know about. Transmission, I have already told you, it is via the respiratory route. Now, what is the CFR? CFR is the case fatality rate. Before I tell you the case fatality rate, let me tell you an important thing. Compared to the previous coronavirus outbreaks, it appears that this present coronavirus 2 has got a higher chance of transmission from one person to another person. Okay. However, the case fatality rates are not yet completely understood. Okay. But many studies have reported it like a range. What you need to know at this point of time is it is between 0.5 to 5% is the case fatality rate of this COVID-19. But generally remember, the case fatality rates are very, very low in the pediatric population compared to the adult population, the reason for which I am going to tell you little later. Now let us try to understand what happens after the virus enters into the human body. Remember, it occurs under 3 stages. Remember, not every person will have all the 3 stages. I am just telling you the natural course of the disease. First phase is called as the viremic phase, wherein the virus attaches to the host cell as well as multiplies inside the host cell. Second is called as a pulmonary phase. The name itself is self-explanatory. The lungs are going to be affected at this time. Now, third is a severe phase, okay, which occurs only in few proportion of the patients, wherein there is a host inflammatory response, or what we also call as a hyperimmune phase. Okay, I will come back to the details as I discuss later on, but as of now, remember it is hyperimmune phase. What is the duration of these phases? Roughly, it is 1 week. Okay, so from 0 days to 7 days, it is the viremic phase. 7 to 14 days, I'm talking about the days, it is the pulmonary phase, and after 14 days is the severe phase. Okay, remember it does not occur in every person, it occurs only in few proportion of infected patients. So what is this phase 1? Phase 1 is the phase of viral replication. Okay, it is between 0 to 7 days, and this is the phase where the patient actually develops symptoms like fever. The two most important symptoms are fever and cough. Okay, right? This is followed by the other symptoms like body ache or the myalgia. Some patients can also exhibit this peculiar symptoms, which is anosmia, which is the loss of smell. Some patients also can have loss of taste. This is because your olfactory and gustatory receptors also express this ACE2 receptors. Okay, but remember, this anosmia and loss of taste are not specific for COVID-19. They can also be seen in other viral infections as well. Now, one more important point I want to emphasize in the pediatric COVID-19 is that children usually present with upper respiratory infection, like an upper respiratory infection. They have this mild fever, they have this rhinorrhea, okay, nasal discharge, rather than as lower respiratory symptom like respiratory distress. No, they usually present with upper respiratory features more than lower respiratory infection. Okay, it's the upper respiratory features which predominant in children. Now, at this point of time, if you do the investigations, what are the findings you are going to get? In the blood counts, you are going to get lymphopenia. Second thing, what I would want you to remember is that there would also be increase in the levels of CRP. What is CRP? C-reactive protein, which is an acute phase reactant. Now, here comes a very, very important point, which you all need to remember is something called as a procalcitonin levels. Now, this is a very important point. Procalcitonin levels will be normal or low if it is only a coronavirus infection. Why should I know this point? Okay, something is normal or low. Why should I know this point? This is because this low levels or normal levels of procalcitonin will help to rule out associated or a bacterial infection. Okay, will help to rule out a bacterial infection. Okay, remember, A child presenting with this respiratory complaints, okay, can also be a bacterial pneumonia, something like a bacterial pneumonia, okay. And for bacterial pneumonia, we have got very good treatment in the form of antibiotics, okay. And if you start antibiotic, that will result in the resolution of the disease, and also it will bring down the mortality. So never ever in the pediatric population in this particular era where we are actually looking at COVID-19 cases, you should not miss out on a bacterial infection. So that is why to rule out a bacterial infection, this investigation procalcitonin is of mighty important and should be done in every case, right? Especially children who are admitted with COVID-19, you should always do a procalcitonin levels. Now coming to the secondary phase, which starts after the first week, that is a pulmonary phase. Now in the lungs, parenchyma, which is the target for this COVID-19. Yes, there are two type of cells lining the alveoli, type 1 pneumocyte and type 2 pneumocyte, which is the primary target for this COVID-19 infection. It is type 2 alveolar cells or type 2 pneumocytes. Okay, you all know that if the type 2 pneumocytes is damaged, what do you think is the problem? You all know that type 2 pneumocytes are very important for protection of the body, okay, or protection of the lungs, okay, in the form of producing surfactant. So what happens when the type 2 pneumocytes are damaged? Surfactant production will stop to occur. So it results in collapse of the alveoli, or what we call it as a atelectasis, right? Now when this becomes very severe, what is the problem, right? You get something called as a ground glass opacities, which you can notice radiologically. Ground glass opacities. And this ground glass opacities is one of the radiological hallmark features of COVID-19 infection. That's what you need to know about. The second point I would want to emphasize is that type 1 pneumocytes are also precursors for type 1 pneumocytes also. So what happened when type 2 pneumocytes are damaged? Obviously, there would be problems expected in type 1 pneumocytes also. Now, what is the importance of this type 1 pneumocytes? Yes, they are very important for gas exchange. You all know that, right? So what will happen if the type 1 pneumocytes are also going to be damaged? Definitely, there is going to be hypoxia, which is one of the important hallmark features of this COVID-19 infection. Now, what is the peculiarity of this hypoxia occurring in COVID-19 infection? It is called as happy hypoxia or silent hypoxia. What do I mean by this? Generally, whenever we develop hypoxia, we go in for breathing difficulty or breathlessness, what we call it as air hunger, right? But peculiarly, this COVID-19 patient, despite hypoxia, they do not exhibit any symptoms. That is why this is called as happy hypoxia or silent hypoxia. So that is why saturation monitoring is of vital importance in while you admit and observe a patient with this COVID-19 infection. The reason for this silent hypoxia is not definitely known. There are so many theories you need not know at this point of time, but just remember, in spite of hypoxia, the patient may not exhibit any symptoms, right? Now, in the lungs, okay, what is the area of the lungs which are damaged? Remember, it is the peripheral areas of the lungs which are actually damaged in COVID-19 infection. Why should I know this point is that if at all it is going to cause pneumonia or consolidation in the lungs, it is the peripheral areas, okay? It is not the central area of the lung which is affected. This is because it will help in my radiological investigation, which I will come back to it when I discuss the relevant portion, okay? Right. Now, as I was telling you, not everybody is going to develop this pneumonia due to COVID-19, okay? Right. There are some group of individuals who are peculiarly prone for this complication of pneumonia due to COVID-19. So, what are the risk factors for development of severe pneumonia in COVID-19? Okay, right. Now, first of all, let me answer this. Why children are not prone to develop this type of severe pneumonia in COVID-19? Because they have got a very good protection in their respiratory tract. What is that protection? Yes, mucociliary clearance. So, this mucociliary clearance will help to wipe out the COVID-19 from the respiratory tract, thereby preventing the development of pneumonia. So, obviously, when I talk about risk factors, patients who are having impaired mucociliary clearance are the ones who are going to be developing pneumonia associated with this COVID-19. So, what are they? Who are they? Okay, it is the elderly persons. Okay, elderly persons. Okay, second is chronic smokers. They are also prone to develop this pneumonia due to COVID-19. And of course, the next one is the persons with comorbidities, especially immunocompromised persons. Okay, right. These are the group of persons who are going to develop pneumonia or further complications, right? Okay, so this is about the pulmonary phase of COVID-19 infection. The next phase is the stage 3 or the hyperimmune phase. Previously itself, I have told you that not many patients are going to enter in this stage. It is actually the host immune response which will determine the outcome of COVID-19 infection in the stage 3. Suppose you have got a good immune response, okay, as is the case in majority of pediatric COVID-19, the patient or the child will overcome that infection and the stage will not even happen. Okay, similarly, adults having good immune response, they will overcome the infection, this phase is not going to happen. So, who are the persons who are going to develop this phase? Are the ones who are going to have a deranged immune response. So what is this deranged immune response? It is in the development of something we call it as cytokine storm. What is this cytokine storm? It occurs due to uncontrolled activation of macrophages leading to the release of this cytokines. Okay, the examples would be the interleukins. Something what you might have studied about in case of in pathology, you might have studied about this macrophage activation syndrome, something similar to that. Okay, so many interleukin cytokines are released, and that is what is going to cause the cytokine storm in these patients. Okay, and most important interleukin you need to remember is interleukin 6. Why should I know this? Because the target, okay, if you can suppress this interleukin 6 or you introduce some interleukin 6 inhibitors, okay, there would be a good improvement coming from this stage. Okay, I will discuss that therapeutic part little later on. Okay, right. The second set of complication which the patients can develop is something called as a vasculopathy. What is the reason for this? I have told you this before, that the persons have ACE2 receptors on the vascular endothelium also. Okay, suppose that endothelial damage is massive. Okay, the virus keeps on attacking the endothelial cells, then they can develop this vasculopathy. So, what is the manifestation of this vasculopathy? Is in the development of clots in the circulation. Okay, the vessel involved could be an artery or a vein or a capillary. Okay, right? It can be arterial or venous. Okay, so that is why the manifestation of this vasculopathy in adults is something like this. They tend to affect the major arteries. Okay, for example, coronary arteries are affected, the patient can land in myocardial infarction. Second is, if the veins, deep vein thrombosis can be a problem, and this can even lead on to this fatal complication, which is pulmonary embolism. In fact, development of this massive myocardial infarction and pulmonary embolism are the factors which are actually causing death in patients, sudden death in patients with this COVID-19. Okay, right. Now this is what is occurring in case of adults. In children, okay, in children it is not these vessels which are affected. In children, it is usually the peripheral vessels supplying the toes and the fingers which are actually affected. So that is why if that happens, they can develop this type of problem. Okay, I think you might have studied this picture in your dermatology classes. What is it? Yes, you can see the swelling, hyperemia of the fingers. Okay, something they might have told you as chilblain, right? This is not the true chilblain. So this manifestation is called as pseudo chilblain. Okay, right. This was also observed in particular set of children affected with COVID-19. So that's why I want you to be aware of this complication. Though majority will not develop this, but still you need to aware that children may not develop this fatal complication. Instead, they develop complications of clots or vasculopathy involving the small vessels rather than the major vessels. So now I'm going to answer your question. Why COVID-19 is mild in children? In fact, many of the children may be even asymptomatic also. What is the reason? The first reason they are saying is ACE2 receptor expression. One, they say is that the pattern of expression is different in children compared to adults. Number two, the number of receptor itself is less in children compared to adults. That is why the disease severity is also less in children. Okay, right? Second is the host response or the cytokine production is very less in children compared to the older population or adults. So that is why the severity is also less in children, right? Third important point they are saying is there could be presence of other viruses which can actually inhibit the growth or attachment of this COVID-19 or SARS-CoV-2 virus itself. Okay, so presence of other virus can interfere with the replication and attachment of this SARS-CoV-2. Okay, and fourth is role of the BCG vaccine. Okay, we give BCG vaccine, okay, for protection from the severe forms of tuberculosis. but BCG vaccine can also give protection against other infections. This phenomenon is what we call it as the heterologous immunity. That means giving protection to some other infection is called as heterologous immunity, and this may be one of the reasons, okay, which could have protected the children from developing severe forms of this COVID-19 infection. Now all these are theory, nothing has been proven, but still, okay, it is very important for us to know why COVID-19 is mild in children. These are the postulated theories which you should be aware of. Now coming to the investigation part, I'm sure that all of you must be knowing what is the confirmatory test. It is RT-PCR, right? Real-time PCR. Okay, I have made a separate video regarding the questions, okay, of this COVID-19 which were asked in this recent exam. Please do go through that video. Okay, I have added more info in that video regarding the investigation part of COVID-19. I'm just telling you the basic facts here. Okay, RT-PCR is the confirmatory test. Usually it is done with the help of the nasopharyngeal or the oropharyngeal swab. Second thing, of course, is the blood counts, where there will be lymphocyte count, there will be lymphopenia. Next is CRP. What happened to the CRP? It will be elevated. Okay. Now, never forget, in children who are admitted with COVID-19 infection, always do procalcitonin. Normal or low procalcitonin level rules out a bacterial infection. I again and again emphasizing this fact because that is of mighty importance. Okay. Right. Now, third is the radiological investigation. Okay. Chest X-ray may show this patchy consolidation changes. CT also shows the same thing. Now in CT, what I would want you to concentrate is some sign which is given and highlighted in the picture. What is that? You can see this. This is something like this. Surrounded by this, there is a opacity, right? Okay, you can see that, right? This is what we call it as a halo sign. One more point I want to emphasize is that you can also do a lung ultrasound. Why I am saying ultrasound here? This is because I told you, remember, the location of consolidation in case of this COVID-19 is peripheral location. So that is why lung ultrasound can be helpful in the investigating these patients. It may not be like a very definitive investigation, but it will help as a screening investigation. And one sign I would want you to remember in this ultrasound lung in COVID-19 is something called as a light beam sign. I'm not going into the details of this, just the name alone is enough. But again, remember, this light beam sign is not very diagnostic of COVID. It can be seen in other interstitial pneumonias also. So, if you have a child who is found to have COVID-19 positivity, what are the next steps? Generally, remember, many guidelines say that only in the presence of warning signs you admit the child. Suppose the child is very sick looking or not taking food and all. But generally, remember, all COVID-19 positive children are better to be admitted because they can be under observation. Okay, right? Even if they are not sick, under observation, for observation, they can be admitted. So, very essential that you admit the children with COVID-19 positivity. Of course, you have to isolate them from other children in the wards, and supportive care is very, very important, as you all must be knowing. Now, the supportive care could be something like for fever, okay, you give paracetamol, okay, you give this paracetamol. Remember, only paracetamol has to be given for control of fever. Why I am emphasizing this fact? Okay, because okay, there are other management or other antipyretics you might have studied about, like this ibuprofen, okay, which is an NSAID. But remember, ibuprofen or other NSAIDs should never be used in this COVID-19 suspected patients or confirmed patients, because it is said that this NSAIDs or ibuprofen especially can increase the levels of ACE2 receptors, and that can actually be dangerous for the patient, because virus is going to enter into the body only through those receptors. So that is why NSAIDs are not preferred in case of this COVID-19 infection. Only paracetamol for fever control. Next, of course, is very, very important. What is that? Contact tracing. Once a COVID-19 positive case is detected, the local health authorities have to be immediately informed, okay, so that they can trace all those persons who were in contact with this particular infected person. Okay, that is by informing the health authorities, contact tracing is done. Most of the times, whenever you are admitting a child with COVID-19, either the child is asymptomatic or only having mild symptoms. So observation is all that is required in most of the pediatric case of COVID-19. So what is the criteria for discharge? Okay, you have to keep the child under isolation for 14 days from the time of diagnosis. and you have to do the testing at the end of 14 days. Okay, you can discharge the child if two tests, okay, are negative. Okay, now remember the time duration between these two tests should be 24 hours apart. If the two tests are 1 minute, if the two tests are negative, which are taken 24 hours apart, then you can safely discharge that child from the hospital. This is what is happening in majority of the cases. Now some children, okay, can be sick at the time of presentation or during the course of hospital, okay, they can worsen also. And for them, okay, you can consider the following treatment which I am going to tell you. But please note that all these medications are not going to be used in every child. Okay, the treatment plan has to be individualized on a one-to-one basis. Remember, it is also decided by your local health authorities. Okay, as well as the treatment plan which is put up in the hospitals where you are practicing. So it is not a general guideline. It is individualized according to the patient and according to the treating physician. Okay, right. So what are the things which you can do? Generally, we say that in a sick child, okay, bacterial pneumonia is more likely. So that is why even if other parameters are negative, still we can consider adding antibiotics. Okay, this could be a broad spectrum antibiotic like a third generation cephalosporin. Okay, and never ever miss out. Okay, this H1N1. Okay, which is actually the season also going on. So if you are strongly suspecting this H1N1 influenza pneumonia, then you can give oseltamivir. Okay, right. Of course, very important, and one of the most important things is respiratory support. That is the oxygen support for these patients. This could be in the form of O2 hood, as well as with the nasal flow cannulas, okay, as well as with the mask, okay. And if the situation is worsening, you have to go for non-invasive ventilations, okay, CPAP, okay. And if it is further worsening, then you have to go for mechanical ventilation. Remember, our target in these group of children, okay, is to maintain the SpO2 in the range of 90 to 94%. This is our target whenever we are treating the children with hypoxia and COVID-19 infection. Okay, right. Other drugs also can have a potential role, which includes this medication which we use for HIV infected children like lopinavir or ritonavir, and chloroquine, okay, or hydroxychloroquine. Remember, this hydroxychloroquine and all is not a common recommendation. Only very few studies, and that too in children more than 12 years only is available. So again, I am telling you, it is individualized according to the patient, not for every child. Okay, right. And you all must have known this new antiviral remdesivir, okay, which is again, okay, not used in every children, but only very limited trial data are only available. Okay, and if the child, very rare, of course, is going to develop something like the cytokine storm, you can go for this immune modifying agents or immunomodulators. So what are the options we have? One option we have is the steroids, okay, dexamethasone or methylprednisolone, right? Number two is interleukin 1 inhibitor or antagonist. I'm just writing antagonist. What is the name of that? You all must have known about this. Yes, anakinra. Okay, and what is the one more interleukin I asked you to remember? In fact, that is the most important interleukin. Okay, it is an interleukin 6 inhibitor. I'm just writing minus s for inhibitors. Interleukin 6 inhibitors. What is that? Yes, it is tocilizumab. Remember, anakinra is not available in India. So most of the times, if at all a decision is made to use this monoclonal antibodies as immunomodulators, it is usually the tocilizumab which comes into the picture. Again, I am telling you, there are very limited data available in children. Okay, so it has to be at the concern of the treating physician. So that's about the management of a child who is actually having a worse course in the hospital, but this is very rare. Most of the times, you will have a child who is doing well, and you can isolate the child for 14 days and then discharge after 2 negative tests. This is a usual scenario. Now, last one point is regarding a baby born to a COVID-19 positive mother. How are you going to manage this baby? Okay, some certain points needs to be emphasized here. Vertical transmission, is there a possibility? There may be a possibility, but at this time there is insufficient evidence. Very important point. There is insufficient evidence to say that there is a definite chance of vertical transmission. So at present, no. Right. Then, what is the cause of the COVID-19 infection? Okay. in the baby, even if the baby is infected, it is usually a very mild course. Okay, very important. Usually the children are not going to develop complications, only a mild course. Okay, right. What about breastfeeding? Breastfeeding definitely should be continued. Very important point, because till date there is no evidence to say that the virus is present in the or secreted in the breast milk. Only thing is that the mother should take adequate precaution by wearing a mask. Okay, so that she prevents this respiratory transmission. Okay, to her baby. Breastfeeding is definitely indicated. That should be remembered. Testing, yes, of course, the baby should be tested at 24 hours, at 48 hours after birth. If both the samples are negative, then there is no need for any after birth, 24, 48 hours after birth. If both the samples are negative, then there is no need for any further testing. But unfortunately, if the baby comes to be COVID-19 positive, then the baby has to be tested every 48 to 72 hours till two samples are becoming negative. Okay, that is what is the testing protocol for a baby born to COVID-19 positive mother. Vaccination, routine vaccination should be given to the baby. There is no reason because of COVID-19 you should withhold the vaccination. The birth dose of BCG vaccine has to be given, hepatitis B, all those things have to be given to the baby. Birth dose vaccine have to be given to the baby. Okay, right. So we have almost come to the end of the discussion. This is in a nutshell regarding the COVID-19 infection in pediatrics. Pediatric COVID-19 is definitely a less severe disease. Most of the children, okay, will present only in the stage 1, and they may recover in the stage 1 itself. Some of the children can progress on to stage 2, but that is very rare. And usually stage 3 is almost never encountered in pediatric population. Okay. Remember, pediatric patient can have extrapulmonary manifestation, especially GI manifestation in the form of diarrhea, vomiting or abdominal pain, and that should also be remembered. Okay, right. In sick children, always remember admitted children, okay, procalcitonin is a must. What is the need for this procalcitonin? It is to rule out bacterial infection. What is the gold standard investigation? RT-PCR is always going to be the gold standard investigation. As I told you, most of the cases are mild or asymptomatic cases. They can just only be isolated and observed. I have told you so many drugs for the treatment, but that has to be individualized according to the treating physician's decision. Okay, right. And always remember, even if the mother is COVID-19 positive, there is no reason for you to withhold the breastfeeding. Breastfeeding should be continued. Okay, right. So that concludes the discussion of this week's topic of the week discussion. Uh, as I have told in my Facebook groups as well as the Telegram groups, okay, I have devised a pediatric revision plan for this 2020 year, that is for the upcoming exams. Every week on Wednesday, topic of the week discussion will be done, and every Friday, around 5 to 10 MCQs based on clinical scenario, which is the recent pattern MCQ questions, discussion also will be done. Please do take part in my Facebook group as well as the Telegram groups. I will be sharing the questions before I put up the video discussion. Please do take part in the discussion. The links for the Facebook group and the Telegram group is shared in the description below. So thanks a lot for watching. Hope this video was helpful. If you have any suggestions or doubts, you can put it up in the comment section below. Please do like this video and subscribe to this channel, and please don't forget to press on the bell icon to get notified of the new videos as and when they are posted to this channel. So very soon I'll be seeing you in the next video. The next video is coming this Friday, and that is about the discussion of clinical scenario based MCQs in pediatrics. Thank you all and have a good day.